Start na po tayo. Magandang hapon po mga classmate, magandang hapon po Doc. Magandang hapon po sa mga nakikinig at mga nanonood. Pagpapatuloy po ang ating topic ngayon, ang foundation, yin and yang organs of the body. So, ang topic po natin about trifle warmer. Whole of interior of the body, which when entered into, would be warm. So, trifle warmer houses all 10 yin and yang organs, divided into 3 parts, the upper, middle, lower, and lower warmer. Part above diaphragm is upper warmer. So, yung sa taas pa, no? Urinary bladder and reproductive system is in pelvic area, which is lower warmer kasi nasa baba po siya. Rest of organs lie in middle warmer. Dito sa may parteng ating spleen stomach po ang middle warmer. Ayan, mas malinaw pa, no? Yan ang triple warmer. So, yun yung parang isang pot siya. Ayan. Ang nasa taas ay ang lungs and heart, upper warmer. So, sa middle warmer ay ang spleen stomach, liver and gallbladder. Kidney naman, urinary bladder, urinary system, reproductive system ay sa lower warmer. So, imagine po natin yung function niyo mamaya. Makikita natin kung paano. So, middle warmer, ayun po ang middle warmer ay yung ating spleen stomach. Para po siyang isang cooking pot. So, ang function niya ay main digestion and absorption of nutrients with intestine. Absorbing pure nutrients and water. Di ba? Pag kumain po tayo, bababa sa ating spleen stomach, then i-digest niya. Then after nun po, i-absorb ang pure nutrients and water. Sending the rest to large intestine to be defecated, yung mga impure po, ibababa naman niya sa lower warmer. Okay po. So, ang lower warmer naman po ay place of kidney and urinary bladder. So, kasi nasa baba siya. Urinary and reproductive systems compared with the fire that cooks the pot and its content. So, nasa baba siya. Yan po yung ating diagram. Tingnan natin, drawing. Sanjaw, upper burner, heat, heart and lungs. Tapos po yung interstitial fluid to blood and epidermis. Yung interstitial po, siya po yun yung fluids found in the cell. Fluids found sa ating blood. Tapos siya din po yun yung nasa, yung epidermis po, yun yung outer layer ng skin natin. Sa middle warmer naman po, stomach, spleen, and pancreas. Tapos, interstitial fluid to dermis. Sa lower burner, small intestine, large intestine, liver, kidneys, gallbladder, and bladder. So yung interstitial fluids po, nagbibigay siya ng interstitial fluid to bones and muscles. So yun po yung gawain ng lower burner. Next po. If middle and lower warmer works well together in harmony, upper warmer with heart and lungs will get ready steam. So kung napakaayos po ng middle and lower warmer, ang upper warmer ay okay din siya, yung heart and lungs. So magkakaroon siya ng steam. Parang kapareho po yan ng if pot is too full or empty, or if fire is too high or low, upper warmer will be affected adversely. So, malaking epekto po pag itong lower at saka middle ay nagkakaroon ng problema. Kung masyado silang mainit, iinit din yung taas. Kung nagdi-deficient sila, magdi-deficient po yung taas. Lahat sila naapektuhan. When treating problems of lungs or heart, so sa upper burner po yun, upper warmer, check if the other two warmers are working well together. When the three warmers are in disharmony, there is major imbalance. So pag tatlo na po yung involved, yung triple warmer, halimbawa may problema na po sa lower, sa kidney, may problema sa spleen, stomach, may problema, major na po yun, major imbalance na. So compared with imbalance in 1 or 2 organs. So talagang pag tatlo na po yung involved na organ, talagang seryoso na po tayong magpagamot o gamutin, i-balance natin. Dahil kung hindi, makakaramdam po tayo ng mas matindi. Talagang papahigain ka na po nun. So habang hindi pa po siya malala, kailangan pong gamutin na hindi naapektuhan yung ibang parts o ibang burner. Often, we see that there are symptoms in one warmer which seem like an excess state, but it is because of a deficiency of another part of the body. Halimbawa po, yung kidney mo ay, yung lung mo ay deficient, lung yin deficient, pwede pong mag-excess sa stomach kasi kung may underlying pong dati ng heat yung stomach mo, then yung heat, dahil pag lang yung deficient ka po, yung heat pwedeng aapektuhan niya yung middle burner mo, itataas niya doon. Eh kung may dati kang heat, mag-excess heat po yun yung stomach, makakaramdam ka po ng pag-init. Siyempre yung mga sign and symptom po na nag-heat in the stomach, nagpo-full heat. So, mabilis yung pulso mo, tulad po ng mga pinag-aralan na natin, pag tinignan po yung tongue coating ay thick, yung sa gitna po, thick na po yan. So, tsaka yellow pag init. If we pay too much attention to possible excess symptom, we can miss importance of deficient symptoms elsewhere. So, pag nanggagamot tayo or pag nagda-diagnose tayo, wag lang po yung excess ang lagi nating tingnan. Tingnan natin bakit siya may excess. Possible na may deficient. Yun. Titingnan po natin. So makikita natin sa pangunahin sa napakagaling pong gamitin sa pagda-diagnose. Tapos syempre yung mga interrogation natin plus yung ating pulse. Yan po, mahalaga po yan para makita natin kung nasaan yung excess or deficient. Pareho po natin yung ititreat. Kung ang sanhi po ng sakit ay yung deficient kaya siya nag-excess, i-treat po natin yung deficient, palakasin natin para ma-dispel niya yung excess. Okay po. Example of triple warmer imbalances. People with thin upper body. Yan. And wide hips and thigh. So maliit yung mga balikat niya, tapos pagdating sa may tiyan, sa hips, ang laki. Maraming ganyan po Or wide upper body. Yan, malalapad yung balikat, malalapad yung chest. Pero yung abdomen, but thin hips and legs. Parang ang tawag po sa amin nito sa Bicol, ipyot. Papaliit po siya dun sa sa hips, tsaka yung legs. Yan. As example of equilibria in fat and fluid distribution. So may disharmony po, hindi ma-distribute ng maayos yung fluid, kaya nag-stuck doon sa halimbawa dito sa yung mataba, yung malaki yung hips niya, andun naka-stuck, hindi niya ma-circulate ng maayos. Ganun din po. So yung malaki yung balikat, chest, nasa upper burner po may problema, hindi niya ma-circulate ng pababa, kaya lumiliit po yung part ng hips. So yun, mga imbalances. So makikita natin sa katawan pa lang po alam na natin kung may imbalances. So, bottom, heavy. Type shows symptoms of heart and lung deficiency. So pag bottom po at saka yung mabigat, ang ibig sabihin po noon ay pure immune system and makakakita ka ng paleness, pamumutla, tapos poor concentration. Mahirap siya mag-concentrate talaga at saka mag-ano ng memorya. Yung madali siyang makalimot. Arrhythmia or anxiety. Irregular heartbeat po yung arrhythmia, so makakaramdam din po siya noon. Tapos makikita din po natin na may swollen leg siya at saka dry cup dahil yung kidney hindi nag-a-ascend ng water sa upper warmer, hindi siya nagdadala ng water. 'Yon. Kaya pag umuubo po ang pasyenteng ito, ang taong ito ay dry, kulang ng fluids. So yung heart and lungs naman should be tonified with points. So kung ganun po, kailangan nating palakasin yung heart and lungs upang makakuha ng energy from middle or lower burner. So, ibig sabihin po nito, kung yung upper burner ay may problema, kumuha ka ng energy sa middle or sa lower. Kaya tutukan mo rin yung spleen, stomach niya. Halimbawa, kung may madalas yung mayroong yung may ubo, minsan lungs lang yung tinusukan natin. Pero dapat makita natin, kung may involvement yung kidney, itreat po natin kasi kung hindi natin ititreat yung lower warmer niya, kung hindi siya nag-a-ascend ng water sa up, kahit po anong tusok mo sa lungs, gagaling pero babalik, gagaling babalik. Naranasan ko po yun sa isa kong pasyente. Nung mapalakas ko po yung kidney niya, ayun po, tuloy-tuloy po yung pagaling. Pero kung tututukan mo yung lungs, next day tatawagan ka uli, may ubo na naman ako. Yung kaya dapat po lagi nakikita natin yung triple warmer relationship. Okay po. So this is development from yin-yang perspective. Yung pathogens, ito yung mga sanhi po ng karamdaman. Ang titingnan natin, ang tawag dyan ay pathogens evils. Ito yung factors disturbing the balance of the body. Siyempre, pag may pathogens, yan po yung nag-aalis ng balanse. Tapos, ang conflict po niya, yung healthy energy natin, Xing Qi, the body resistant and self-healing abilities. So, pag may pathogens, ang panglaban natin yan, yung Zeng Qi natin. Napag-aralan na natin paano napoproduce yung Zeng Qi, So, ang pathogens po, karaniwan excess. So, pag excess po siya, excessive yin evil, example, invasion of external dampness or coldness. Kaya excess dahil damp, saka yung ng cold. So, pag umatake po yan, nagkakaroon ng yin excess at magbibigay ng sakit sa tao. Ganon din po pag yung excessive yang evils. Pag yang naman yung mga init. Example, pagpasok ng external wind or heat. Yan. So magkakaroon ka po ng yang excess. Yung balanse ng yin and yang sa katawan, mas tataas yung yang. So ang nangyayari po noon, nagkakaroon ng deficient dun sa ating Zeng Qi. So deficiency of yang Qi, yung physical underlying function, nagkakaroon ng yang deficiency. Bababa yung yang dahil tumataas yung yin, yung evil. Natatalo siya, natatalo yung ating defensive Qi, yung resistant Qi natin. Tapos, pag yung excessive yang evils naman pumasok, magkakaroon ng deficiency of yin sa ating katawan. Yun, magkakaroon ng insufficient nutrients materials. Kaya, yung yin bababa, yung yang tataas. So, ganun siya nadidevelop pag pumasok yung mga pathogenic factors na yan. So, pag nakita po natin yan, so dapat ibabalanse uli natin yung yin and yang, papalakasin natin yung healthy energy. Yung yang na deficient ay kailangang matonify natin. Ganon din yung yin. Tapos yung excess dapat ma-dispel natin. Yung yin at saka yang. Para mag-balance at mawala ang sakit. Okay po. Ay, hanggang dun lang. Okay po, may dagdag po, may tanong. Kung wala po, maraming salamat.
Thank you very much, Ma'am Mildred. We will now continue with tongue diagnosis. And straight from Zamboanga, let's welcome Ma'am Teresita Sumile. Good afternoon po, Ma'am Teresita.
Good afternoon po, Dr. Hector. Good afternoon din po sa mga kaklase ko. Okay, welcome po sa tongue diagnosis. At ang topic po natin ngayon ay dry and white or yellow coatings. Independent of its color, a dry or rough-looking coating always indicates depleted body fluids. Okay? For example, a white, greasy, dry, or rough coating may suggest spleen and stomach Qi deficiency, as well as deficiency of fluids in the stomach. Owing to its weakness of spleen and stomach Qi, there is accumulation of dampness, giving the coating its greasy consistency. Okay? Now, deficiency of fluids in the stomach means that the tongue is not receiving adequate moisture. Thus, the coating will appear dry. Okay? If the coating is yellow and dry without being sticky or greasy, it indicates injury to the fluids by internal heat, which will thicken accumulated dampness or phlegm in the interior. As a result, the coating will become rough and dry and yellow in color, all of which suggests the presence of heat. Okay? Now let's go to our first patient. 31, female, 31 years old. Tongue description, pale red, red raised points in the anterior third, dry, rough, white coating. Symptoms are swollen cervical and inguinal lymph nodes, stomach pains and epigastric fullness, and distended lower abdomen. Western diagnosis is non-Hodgkin's lymphoma, and background to disease is condition followed radiation therapy and chemotherapy. Chinese diagnoses are normal, heat toxin in the upper burner, and deficiency of fluids in the stomach. Now let's go to analysis. Normal tongue body color is pale red. Okay? Heat toxin in the upper burner is reflected in the raised points in the anterior third. Deficiency of fluids in the stomach is manifested in a dry, rough coating of the tongue. In this case, patient presented symptoms of swollen cervical and inguinal lymph nodes, stomach pains, and epigastric fullness, as well as distended lower abdomen, resulted from radiation therapy and chemotherapy. Okay, now let's go to our second patient, female, 39 years old. Tongue description, pale, swollen with teeth marks, vertical cracks with vertical crack with light yellow dry coating, white dry greasy coating in the middle third, greasy thick yellow coating with red points in the posterior third, and slight depression at the root of the tongue. Symptoms are loose teeth, bleeding gums, frequent periodontitis, strong smelling watery diarrhea, flatulence, sour taste in the mouth, and exhaustion. Western diagnosis is periodontitis, background to disease, irregular lifestyle during puberty with alcohol and drug abuse. Chinese diagnoses are spleen Qi deficiency with accumulation of dampness, accumulation of phlegm with slight heat developing in the yang brightness Yang-Ming channel, insufficient production of fluids, spleen Qi deficiency, retention of damp heat in the lower burner, and slight essence deficiency. Analysis. Spleen Qi deficiency with accumulation of dampness is reflected in a pale tongue body color with swollen body shape and has teeth marks. Okay. Accumulation of phlegm with slight heat developing in the yang brightness Yang-Ming channel is manifested in a vertical crack with light yellow dry coating. In this case, patient presented symptoms of strong smelling watery diarrhea and flatulence. Insufficient production of fluids with spleen Qi deficiency is shown in a white, dry, greasy coating in the middle third. Retention of damp heat in the lower burner is reflected in a greasy, thick yellow coating with red points in the posterior third. Patient showed symptoms of loose teeth, bleeding gums, and frequent periodontitis resulted from irregular lifestyle during puberty with alcohol and drug abuse. Slight essence deficiency is manifested in a slight depression at the root of the tongue with symptom of exhaustion. Okay, now let's go to case number 3. Female, 32 years old. Tongue description, pale, slightly thin, red teeth, vertical crack with light yellow dry coating, greasy, dry, pale yellow coating. Symptoms are cough with copious mucus, blocked nasal passages, thirst, dry mouth, heartburn, and exhaustion. Western diagnosis is chronic sinusitis. Background to disease are excessive consumption of dairy foods and caffeine abuse. Chinese diagnosis are slight deficiency of blood, heat from deficiency in the heart, accumulation of phlegm with slight stomachache deficiency, and deficiency of fluids with internal heat. Analysis. Slight deficiency of blood is shown in a pale tongue body color with thin tongue body shape. Heat from deficiency in the heart is reflected in a red pit with symptom of heartburn. Accumulation of phlegm with slight stomachache deficiency is manifested with a vertical crack at the center with light yellow dry coating. Patient in this case presented symptoms of cough with copious mucus, blocked nasal passages, thirst, dry mouth, and exhaustion caused by excessive consumption of dairy foods. And the last is deficiency of fluids with internal heat is presented in a greasy, dry, pale yellow coating resulted from caffeine abuse. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. If there are no questions, can we proceed to diagnosis by interrogation? We will start a new chapter. It's about sleep. This is a very important topic because ang dami pong may mga insomnia na pasyente. So we will teach you how to ask intelligently. Okay? So let's start with insomnia. Sleep disturbances are very common in Western patients. So when you ask about a sleep problem, you need to clarify whether there is difficulty in falling or staying asleep, waking up early in the morning, or excessive dreaming. So ito yung mga apat na types of questions that you need to ask, no? We should ask every patient about his sleep because it gives us an indication of the state of the mind, which is the shen, and ethereal soul, the hun. Napaka-common po ngayon ang may disturbance of the mind and ethereal soul, whose life is generally subject to a considerable amount of stress. And I believe it is not only in Western countries, but in Asian countries as well. The length of sleep needed varies according to age. Okay, so it gradually decreases as one grows older, highest in babies and lowest in the elderly. So we should therefore take age into account when judging whether the patient's sleep is adequate. So when do we ask? We ask about asleep and dreaming early during the consultation in every case. So pag the patient doesn't apparently present with any problems of that kind, we always ask about sleep and dreaming to get an idea of the state of the mind and ethereal soul. So there should always be a dream component. No? How do we ask? So we should be specific when asking about sleep and dreaming. It will not suffice to ask, do you sleep well? Okay. So you have to ask, do they fall asleep easily? Do they wake up during the night? Or do they dream excessively? So itong dreaming excessively is difficult to define because we all dream. Because dreaming is an essential part of sleep, performing a function that is still the subject of debate. So what constitutes excessive dreaming in Chinese medicine? So this is defined as either having many dreams to the point of feeling exhausted in the morning because of them, or as having unpleasant dreams which will leave one tired and slightly disturbed in the morning, or waking up during the night. Nightmares are also a form of excessive dreaming. So if the patient dreams excessively, we should ask if there is a recurrent dream. No? So apart from a modern psychological interpretation of dreams, according to the theories of Freud, Jung, and others, we try to interpret recurrent dreams in terms of Chinese medicine. For example, if you have recurrent dreams of water, now this is interesting, di ba? Kung panganaginip niya puro water, this indicates a kidney deficiency. In Jungian psychology, water is a symbol of the unconscious. Sleep depends on the state of blood and yin, especially of the heart and liver. Although blood and yin of other organs also influences sleep. So during the night, we all know that yin energy predominates. So this means that the mind and the ethereal soul should be anchored in heart blood and liver blood. So yung heart blood will anchor the mind or the sen. The ethereal soul will be anchored by the liver blood. Okay? So you can see it here. So ibig sabihin, if you have deficient heart blood or heart blood deficiency, walang mag-a-anchor sa mind. So your mind becomes restless. And also, pag walang liver blood, kung meron kang liver blood deficiency, walang makaka-anchor sa ethereal soul. Okay? A sleep disturbance may be due to the mind and or ethereal soul not being anchored. No? So because there is not enough blood or yin to anchor the mind and or the ethereal soul, or we have a pathogenic factor like heat that will agitate. So the first one, yung liver blood or yin deficiency, is an empty type of sleep disturbance. Samantala, yung due to the heat or the pathogenic factor, this is full. In both cases, the mind and or ethereal soul floats at night, causing insomnia. Deficiency conditions. Difficulty in falling asleep indicates heart blood deficiency, spleen blood or liver blood deficiency. Difficulty in staying asleep and tendency to wake up during the night will indicate yin deficiency. Waking up during the night may also be due to full conditions like heat, fire, phlegm fire, or retention of food. So again, difficulty in falling asleep indicates deficiency of blood or yin, whereas waking during the night indicates yin deficiency with empty heat. So I guess that was very easy. Any questions po? This is very basic, no?
Doc, may share po akong yung lagi pong nananaginip siya ng water. Pero yung ethereal soul po niya, parang lumakas, diba yung dreaming po sa water. Sabi po niyo kanina, tama, spleen, stomach siya, yung energy. Tapos, yung yung bawat dream niyang ganun, diba yung ethereal soul natin na sa ating lungs. Pag tubig po, sinasabihan niya agad yung panaginip niya kung sino yung involved na tao doon. Nagkakaroon ng problema, parang nahuhulaan niya. Pwede po bang sabihin niyo na yung dream na from the spleen stomach, ibig sabihin malakas yung chi ng stomach, ipapasa niya kay lungs. Lalakas din yung ethereal soul, kaya parang nakakapag-interpret siya ng dream. Ganun po ba
Hindi
yun?
siya malakas kasi the mere fact na nananaginip ka ng water, it simply means na mahina yung kidney. So kung mananaginip ka ngayon ng mga ano ba to? Ng kahoy. That means mahina din yung mahina kasi walang mag-a-anchor. Kasi whatever you lack, nagmamanifest sa dream. Yun po yun. So it doesn't mean na malakas yung ethereal soul. Obviously, pag mahina po yung kidney, pag medyo panay-panay na, we have learned na this will definitely affect the liver, di ba? So ano ba yung liver? It's actually about It's about the ethereal soul. It's about nakikita mo. May nakikita ka ng iba na hindi dapat nandoon. Yun. So there are so many things that we need to really look into. Like if you dream of fire, no? So that means you have you have weak heart or meron kang heart blood deficiency. Kung ano yung kulang mo, yun ang nagme-manifest as excess. Yin and yang.
Opo. Ang ganda naman.
Interesting, di ba? So,
Yes po, tingnan mo sa mga panaginip lang,
yeah,
involved
are
pala
you
yung mga
excited?
organ.
So first, let me summarize. When you ask questions intelligently, ang dami po kasi may insomnia. So the first, you need to determine, first, nahihirapan ba siyang mag-start matulog? Does he have difficulty getting sleep? And pangalawa, o sinabi niya, hindi naman. The next question mo niyan ngayon is, does he keep on waking up in the night? Like, you interrupted yung sleep. Pwede namang madali siya makatulog, pero kung parati ka nagigising every hour, that's another issue. And the third one, I think there are four, no? The third one is about dreams, no? Yeah. Saan ba dito? Ito na yata. Okay. See? Dreams. Importante po yung dreams. Okay? Whether they dream excessively, yun po yun. Lahat kasi tayo nagdi-dream eh. Diba?
Yes, very yes.
At saka obviously, if you have like, what's this? Kasi pag hindi po nag-anchor yung, like you have an issue with the liver, no? Bakit ba nagkakaroon ng issue ang liver? Kulang ka sa liver blood. So there is no anchorage for the ethereal soul. And ethereal soul, the hun, is something about vision. No? It's something about, like, kaya yung iba nakakaano eh. Yun. Wait lang po hanap buhay mo na ako. Nagkakagulo yung aking appointment. Wait lang.
Grabe, ikaw na talaga, Doc.
Ang hirap ako pa nag-handle ng Zoom. Tapos, they all wanted, ako kasi I only see patients Thursday, Friday, Saturday. So everybody wanted. Can you imagine? There was one she would like to open at 8. Okay, whatever. Yung iba kasi come, wait lang. Please give me time. Okay. Saturday. Okay, yun. Ano ba sasabihin ko? Okay. I hope you all feel the same way, no? Lahat naman tayo nag-aaral dito, and when people come back to you often, that means you're good. How do we become good? We have to study. Kaya I find this Zoom thing very, very interesting. And I cannot just imagine how some people, like kanina, no, may nagtanong, she has been to another, sabi niya, bakit daw ako tumitingin sa dila? Alam mo kasi, it's just like going to a doctor, then hindi ka chinek up. Wait lang, ha? I-ano ko na lang. Okay, yun. So, na-amaze siya. Alam mo na, then we also look at the ear. So yun eh. You have to level up. Okay? And I have to admit, I'm very happy because everything naman requires an effort eh. So if you just wanted to be like mediocre, that means you don't really care for the patient. Okay.
Very true.
Yeah. And then you also have to allow time to rest. Kasi if you're so fatigued, like you see so many patients in a day, hindi na quality yung service mo for the patient. Kung puro pera-pera na lang.
Yes.
Oo.
Tsaka madideplete din, Doc, yung energy ng
dapat madideplete yung energy
manggagamot.
mo.
Kailangan balance talaga siya.
Nag-ano na. Sige.
Meron nga po sobrang kasi ang daming pasyente. Hindi mapauwi dahil galing pa sa malalayo. Sige, gamot ang gamot. Pero pagkatapos po nun, na-flat siya yung talagang halos paghiga niya, binabangungot na eh. Halos wala yung energy na wala nang nag-aangkor sa spirit.
Yan mahirap eh. Pag yung mga tao kasi saka gusto mo makatulong na ano ka.
At saka you should always realize, if yung tao wala nang direksyon yung buhay, wala na siyang vision, wala na siyang foresight, may problema na sa Shen yun. Ibig sabihin may liver blood deficiency. And you know what's amazing is, ako kasi like, syempre okay, sige, late lang ha, kasi we need to really fix the time. Buti na lang may mamababait na nag-give
Sige
way.
Doc, magkukuwentuhan muna kami.
Magkwento
Mag-sharing.
muna kayo kasi to.
Yes, sir, Sir, magkwento ka muna habang may inaayos si Doc.
Sige,
Sir
sharing.
Michael, share ka po.
Ako, lagi ako nagkakaroon ng dreams. Mga ahas naman, tsaka o kaya yung pollen. Yung mga nabuhulog, yung mga ganyan. Minsan lumilipad, yung ganyan.
Health issue daw po pag-ahas.
Health issue? Okay.
Kasi ako din po, nung may
ahas.
sakit po ako, puro ahas din yung napapanaginipan ko. Pero hindi ako kinakagat, as in napakaraming ahas. Binabanigan ko rin para makadaan ako. Pero totoo po nun, yung panahon na yun, talagang bagsak ang yin at saka yang. Pero nasurvive kasi hindi ka naman kinagat eh.
O, di ba
Parang ganun
amazing,
po.
di ba? So you need to know yung talaga, yung concern ng patient, di ba? The kind of questions that you will ask is very, very important. Hindi yung tusok ka agad, no? Kasi daw yung una daw niyang pinuntahan noon, tusok daw ka agad, wala nang tingin-tingin. Ako kasi when I see a patient for the first time, I don't usually like ni-refer lang kasi sa akin. I am tied up with a spa kasi, like nagpapaano siya, nagpapa-eyebrow. Sabi niya, I have numbness of my fingers at the same time. Mayroon daw siyang vertigo, o di ba? So before ko tingnan yung dila niya, alam ko na ano makikita, and I was right, o di ba? And so binigyan ko siya ng parang yung parang lang para they will really come. Kasi ayaw ko kasi yung parang pumunta ka lang, nagpa-acupuncture lang dahil they have another plan. So they didn't go there for the acupuncture alone. So what I did, I just used the ear, the usual 3 points. So what I did, of course, when I checked nakita ko kagad yung iba talaga yung dila niya. Very, pag nakita nyo yung very swollen yung anterior third, the sides are very red, and there's a little blood stasis. So inano ko lang siya, ninidle ko lang siya sa ear, and na-amaze siya na wala yung vertigo niya in roughly 2 minutes, 3 minutes. And sabi ko baka iniisip lang. And she was so excited. Sabi niya, how much am I going to pay for this? Sabi ko, huwag ka na magbayad. O, di ba naging 2 na? Sabi niya, I'll bring my husband. O, di ba? And the husband is Swedish. O, at least nilibre mo yun. Kasi ano lang naman yun, ear seeds and... diba? So, doon pa lang na-amaze na. So, they were like, so, syempre, inano ko na rin. Gusto nila dyan yung mag-aral ng acupuncture kasi the previous patient, I asked kasi na magdala ng kanyang katulong. And tinuturuan ko na siya magwasha. Sige, para na lang. Happy siya. Happy lahat. So, sabi ko ganun talaga. So, you need to educate. It's not because you want only the money for, And you will see, talaga nagmumultiply sila. No? Pwede nga, libre mo lang yung iba. Like tomorrow.
Yes, talaga, pag gumaling na sila na yung nagte-testimony dun sa experience nila.
Pero sinabi ko, hindi pa yun na. Siyempre, they have to come. Sabi ko, you need to really have the complete one. So, hindi naman siya nagreklamo when I mentioned the price kasi she was happy. Pero ang goal ko talaga doon, mag-aculift sila eventually. Kasi when you do aculift, you just don't, improve the face. Remember, our approach is holistic. And the lump aculift, no? I don't know with the other cosmetic acupuncture. So, can you imagine, gumanda ka na, naalis pa yung health issues mo. Diba? Yun.
Yes.
So that's it. So I was thinking, sabi ko, this Zoom really helped. And it's just a pity that not too many people are probably interested. I don't know. Maybe they know a lot already. But ako kasi this is a continuous learning experience.
Yes.
least we should all be humble to accept the fact that, hindi mo naman makukuha ka agad dyan eh. Diba?
Yes.
Mastery ang importante. Yun.
Yes po.
So I hope dadami yung natin. Kaya I'm very thankful sa ating mga, alam ko naman, remember this is pro bono ha. Nobody gets paid here. And yet, we see a lot of people volunteering kasi nakakatulong sa practice, di ba?
Yes
Yeah.
po. Habang nag-aaral tayo, Dok, may-apply talaga actual sa pasyente eh. Yun po yung bonus nun.
Oo, tapos parang lumawak yung yung pag-uunawa, no?
Yes po.
Oo,
Yes.
parang meron kang eagle eye. So you
Yes
already
po.
know.
Totoo yan.
True. And hindi kasi ito puro ewan ko lang. Even if you're an MD, it doesn't mean that you know TCM already. No, that's not acupuncture. So I still have to look for an MD like Dr. Gavino. He really knows. Initially, he was very skeptical, no? So inaral niya. Tingnan niyo naman ngayon. Talagang focused na focused.
Oo nga po. Malaking bago mo.
Intindihin nyo naman, he wanted us to learn. So you have to be very, what's this? You have to be budol resistant. Kasi pag budol resistant, wala ka talagang alam. Yun lang yun.
Pero ang ganda naman po nung tanong niya, mag-iisip talaga eh. Mag-iisip kami.
Bawal kasi,
Opo.
hindi po kasi
Pero
dito.
nakakatulong talaga yung question niya, mga question niya. Mag-iisip ka talaga eh.
At the end of the day, you realize na he really just wants us to learn, no?
Yes po.
And that's something na hindi natin makukuha talaga sa isang ordinary teacher, no?
Yes.
Yeah. And let's continue to learn. Kasi tiyaga-tiyaga lang. Wala pong nahuhulog na grasya lang basta-basta. You have to work hard for it.
Yep.
So are you now inspired, Sir Michael?
Opo. Ay, excited ako sa March 14 ha.
Si Sir Michael, magiging presenter na rin yan eh.
Well, in due time.
Yung medical mission?
Yeah, March 14 I think. Yeah, March 14.
Okay.
Pero may good news din ako kasi nga iniimbitahan ako si St. George mag-speak. Kasi yung ilang pasyente na natulungan ko, hindi pa ako nagtutusok ng doc. Binigyan ko lang sila ng mga advice na natutunan ko rin dito. Mga pagkain din, meron din. Eh, gumanda ang nila. Wala pa akong ginagawa. Speak pa lang ang ginagawa
kasi dapat no? This is not just about tusok, no? It's also about counseling. It's about
yes.
The amazing thing here is sa mukha pa lang alam mo na yung ugali, alam mo na yung magiging issue niya. And bago niya ipakita yung dila niya, you already know what to expect.
Yeah, doon sila na-miss. Titingnan ko pa sila, alam ko na yung sakit nila.
Tapos bago siya mapulsuhan, sa pulsuhan, alam mo na yung
nabigyan mo na sila.
Yung emotion pa kasi nila, Doc, natatouch natin, di ba? Para mag-balance yung katawan nila.
Yes po, totoo po yan.
Pero nga po akong pasyenteng dati problematic sila yung relation nilang mag-asawa, pero sinasamahan siya ng asawa niya pag nagpapatreat sa amin. So naririnig niya yung advice. Unti-unti nagbago yung asawa. Kasi sabi ko, kung hindi tutulungan yung asawa, pabalik-balik kayong magpapa-acupuncture. Kasi kahit ina-acupuncture ko yung emotion na hindi naayos, babalik po yan. So okay po naging maayos yung relasyon nila.
Ang inaano ko sa Thursday, mukhang 5 yata yung pasyente ko sa Thursday. 1, 2, 3, 4, 5.
Grabe, Doc. Grabe ng pasyente mo, ha?
Pero I try to give quality talaga. I hope you can follow the same, And make your patient feel comfortable. So you should be knowledgeable, di ba? Kung di mo alam, di mag-aral ka. Wala pong dapat lokohan. Yun. Okay, let's now continue with Paul's diagnosis. And let's call on... Ay, sino ba magpo-pause? Will it be... Ma'am Mildred. Yeah.
Okay. Paul's diagnosis, overflowing pulse. So part 2 po ito. The overflowing pulse on individual position indicates either heat in that particular organ. So pag tinignan natin yung tongue, siyempre red yun, heat yun eh. Tapos yung pulse mismo ay rapid. Or maaari din daw itong may severe emotional problem related to that particular organ. Diba, sa heart, liver, and lungs. Pag tinapat po natin yung ating fingers doon, mararamdaman po natin yung overflowing pulse. Yan. Tapos yung magre-reflect pa dun sa kanyang tongue. So overflowing without strength. The overflowing pulse without strength feels large, superficial, and flooding. But it is disappear when more pressure is applied. So pag diniinan mo, nawawala siya. And it has no strength at the deep level. So pag idiniin mo pa ng ganun, wala ka nang mararamdaman. It is strength indicates yin deficiency kasi deficient, kaya pag diniin mo, nawawala with empty heat. And exhaustion of body fluids. In this respect, its clinical significance is the same as that of floating empty pulse, but it indicates a more severe stage of it and more intense empty heat. So, mas severe po yung pag floating empty pulse. Mas severe na po siya. The pulse may also be overflowing without strength and floating. Nagsasabi naman po ito ng severe yin deficiency. Pag overflowing in floating, severe yin deficiency. Intense empty heat and chi rising to the top. So severe deficiency, yin deficiency, or intense empty heat. According to Dr. Shen, an overflowing hollow pulse is frequently seen in hypertension and diabetes. Yung may mga sakit po ng hypertension yun. Pag pinulse natin yun, maramdaman. In the former condition, the pulse is overflowing and hollow more in front and middle position. So sa pag kinapa po natin yung middle position, yung guwan sa may part ng liver. Whereas in the later, more so in middle and rear position. So kasi nga yung hypertension related yung liver doon. Common condition that present with an overflowing pulse include mental illness, febrile diseases, and severe emotional problem. So pag may mga ganong kalagayan po, may siyang problem, overflowing po yung pulse. Overflowing pulse, summary of clinical significance. So pag full heat po, overflowing with strength. Pag pinatong natin yung kamay natin, sobrang malakas siya, nararamdaman mo agad. Tapos yung may stomach heat patterns at chi level. Yung yin deficient din po with empty heat. Yun, overflowing without strength. Pag deficient, without strength po yung mararamdaman natin. Pag full, with strength. So yung pagkakaiba niya. So combination. Pwede pong mag-combine na, no? Overflowing clothing indicates invasion of wind heat with intense heat. This condition would progress very rapidly to the chi level. So from exterior, pwede po siyang pumasok. Yung chi na yung aapektuhan. Overflowing clothing without strength. So pag without strength, denotes severe yin deficiency with empty heat. So pag without strength, ulitin po natin, ay yin deficient. Overflowing deep indicates internal heat. Pag pinatong natin yung kamay natin, mararamdaman natin mas malalim ng konti. So, internal heat na po yun. Overflowing slippery. So, slippery indicates phlegm heat with prevalence of heat. So, yun po yung ng pulse. Overflowing soft indicates yin deficiency with exhaustion of body fluids and empty heat. So, pag pinatong mo yung kamay mo, nararamdaman mo, pero parang wala din. Deficient kasi, kaya ganun po yung pulse. Overflowing tight indicates chest painful obstruction. So, tight. Pag may tight, may obstruction. Pwede daw pong blood in the stool with constipation. So, yun. Overflowing hollow rapid with strength. Mga combination na po siya, no? Indicates imminent bleeding. May bleeding. Overflowing hollow weak indicates previous hemorrhage. Siyempre, weak kasi pag nawawalan ng dugo nagkakaroon ng hemorrhage. Kaya weak ang mararamdaman. Differentiation of similar pulses. So pag the big pulse is very similar to overflowing pulse. So halos magkapareho siya. Insofar as they are both superficial. So papatong mo lang yung kamay mo, nararamdaman mo agad. Large and going beyond the pulse boundary. The big pulse, however, is rounder than the overflowing pulse. So ang pagkakaiba lang po nung big, pag pinatong mo yung fingers mo para pakiramdaman siya, parang round, hindi siya pakalat. Ang overflowing pulse kasi, it has more shape. Yung parang sabi nga nung una, para itong papakalat. And it is not necessarily rapid. Siya hindi mabilis. Yung pag full naman po, the full pulse simply indicates that the pulse is full and relatively hard, whereas the overflowing pulse is larger than its boundary. So pag full, pag pinatong mo yung fingers mo, mas parang mabigat yung pakiramdam mo. While overflowing pulse, mas malawak yung mararamdaman mo siya. More superficial and relatively softer. So yun po yun sa ng overflowing and full. Pag long naman, talagang kailangan nakakonsentrate ka nagpa-pulse para ma-identify mo yan Halos di ka humihinga The long pulse extend beyond the pulse. Yun. So pag pinatong mo yung kamay mo, sobrang mararamdaman mo yung lampas dun sa line ng pinagpapatungan mo. Lengthwise is not superficial, hindi siya superficial. So the overflowing pulse extend beyond the pulse position. So kahit pinatong mo na yung kamay mo, lumalampas yan dun sa mga malawak yung sakop niya. Tapos in all direction and it's superficial. Pag superficial, pumadali mo siyang maramdaman. Pag patong mo pa lang nung kamay mo sa balat, nararamdaman na yung long pulse, yung long pulse. So marami siyang klase. Next po. Clinical significance in its position. Lysogen. So front position. Left front. Kasi pag nagpa-pulse, di ba tayo yung sa bandang left ay heart sa tune, sa kun, yan. So, heart file blazing upwards. Right front, feeling of heaviness in the chest. Pag middle naman, ang middle po ay nasa left pa rin po yan, sa guan. Pagkatapos ng heart, ay liver. Kasunod mo, tapatong ulit yung fingers mo. Middle position. Liver yang rising. Stomach and spleen deficiency. Yan, mararamdaman mo po dun sa left kasi yung spleen. Okay. Rear position. Exhaustion of kidney essence. Deficiency of pin with blazing fire. So, yun ang yan. Talaga po ang pagpapulse. Siyempre, hindi natin agad yan, kasi may iba-ibang klase. At least, natatandaan po natin pag may heat, may cold, alam natin yung mararamdaman. Kung nasa superficial, yun, alam po natin. Kaya itong mga lesson po natin, dahil naka-zoom naman, pwede po natin balik-balikan para makabisa natin. Kasi nakakatulong din pong malaki yung pulse. Thank you po.
Kasi I'm sure a lot of people, mayroon ng following yung mga seryoso. And I think we're doing the right thing. So next we go to differential. Thank you, Ma'am Mildred pala. Okay.
Yes po.
Mamaya
Welcome lagi.
Yeah. We will now go to differential diagnosis, and let's buti nandito na si Ma'am Needs. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector, and good afternoon, everyone. How's my audio, Doc?
Clear po.
Okay, thank you. Okay. So, the lesson for today in our number 164 is the kidney yang deficiency. Okay? So, kidney yang is the life gate or the lower fire of our body's triple burner. Okay, it can also be viewed as our basal metabolism, at times referred to as the Mingmen. Mingmen. Okay. Kidney yang is responsible for vitality, action, food and water metabolism, assertiveness, and libido. Okay. Deficient kidney yang may show with such pattern as asthma conditions, urinary incontinence, fatigue, impotence, anemia, excess urination, cold lower back and legs or generally bodily coldness, abdominal and lower extremity water retention, hypertension, and a weak lower back. So, tandaan natin kapag deficient kidney yang may cold, okay? It can usually but not necessarily always be found with the elderly, okay? So, kidney yang is how Chinese medicine explains the warming function in our body. For that's not quite right, but it's good enough for the rest of us here. So, kidney yang draws its energy from the Mingmen and Jing essence, as does kidney yin, but it applies it to make things warmer. So, siya yung warm. So, etiology, chronic illnesses, excessive sexual activity, exposure to cold after sex, retention of dampness from spleen deficiency, and old age. Underlying or accompanying pathology, kidney deficiency, spleen chi deficiency, retention of dampness. Okay? Sign and symptoms, feeling of coldness. Remember coldness, okay? Not good at keeping warm, always wearing lots of clothes. So, can't easily get warm. Malamig, pakiramdam niya. Malamig yung likod, especially sa lumbar area. So, kakapain nyo rin para nyo rin malaman kung ano yung ng pattern. Sa lumbar kasi, that's one of the area of the body ruled by the kidneys. Okay? Yung kidney nandyan sa lower back of the body. Cold knees, yung mga tuhod malalamig. Kasi yan din yung isa sa mga nirurule ng kidney. Profuse urine. Kasi hindi ma-warm ng body, yung kidney yang hindi ma-warm yung body natin, so fluids will pass through too fast and easily since they haven't been warmed and concentrated. Okay? Clear, colorless urine. Your kidney yang hasn't supplied the energy to concentrate. Okay? Odorless, kasi yung kidney yang hasn't the energy to concentrate and heat it. So, kaya walang amoy. Increasingly frequent urination at night. Here, we get another kidney yang function. Okay? This normally supports the yang of other energy organs, Zangfu, in the body, like the bladder and the spleen. If these organs lack yang, they can't keep things in place. So, you need to urinate more often, even at night, okay? Or the same reason, a tendency to incontinence or to dribble, even after you think your bladder is empty. Okay? Mga symptoms. Edema sa lower part ng body, starting from the legs, pero nagiging worse, rising up to abdomen. Edema, ibig sabihin nun yung swelling from water retention. Yung legs nagsuswell up, at kapag pinisil mo yung thumb, mayroong pitting, makita mo may mark that is called pitting edema. So, after letting go, the flesh takes a while to return to its normal shape. So, here, your kidney yang hasn't even been able to transform the liquids in your body into urine. So, as it worsens, you may get. Okay? Urinary retention naman, yung inability to pee enough. Hindi makaihi, parang kulang ganun. Though any urine would also still be colorless because kidney yang warms the things. When deficient, it fails to warm and dry. So, along with the coldness mentioned above, these are digestive weaknesses. Okay? Stools are loose, runny, with little or no smell. Remember, no smell. Cold food, food that is uncooked, raw or unheated even when eaten, or chilled or frozen, may go straight through you. because kidney yang deficiency means that there is no fire to cook what you eat. Okay? With the accumulation of fluids, you may appear to be overweight, but because kidney yang deficiency leads to spleen yang deficiency, you cannot turn the food and liquids you consume into blood. So your body lacks nourishment and your flesh lacks tone and firmness. Okay? May backache. So bakit nagkakaroon ng backache? Especially in the lower back, lower lumbar area. This worsens the longer you stand. So lumalala siya habang mas matagal yung pagtayo mo, or nagkikerry ka ng mabibigat na bagay habang lalakad ng slow, nag-worsen and tends to deteriorate throughout the day. This form of backache is usually much better for resting, sitting, lying, and after sleep, and from warm on it. Okay. Curiously, if you can walk fast, you may find it doesn't get sore so quickly. So it's walking slowly that is the problem. Parating kailangan mag-rest. Okay. Weakness in your knees, weakness in the legs, no strength to walk far, let alone climb hills or stairs. And if you do have to climb, you need to stop for breath or better, okay, or to sit down. Okay. Ears, may tinnitus and sometimes reduced hearing. Nawawala minsan yung parang nabibingi ganun. Ears, mayroong dizziness, mayroong lassitude, a state that goes beyond tiredness and includes disinclination to do anything. Apathy. Facial color is a kind of bright white shade. It comes with exhaustion. May depression, hindi galing sa chi stagnation. Probably the most common cause of depression, sick also from the book, but from lack of bounce or lack of will or spirit. This kind of depression takes various forms, but usually has elements of apathy and hopelessness, a kind of giving up. So yun yung pagdahilan ng depression niya. Marami kasing klase ng depression. In the long term, weakness in kidney function also brings difficulty remembering things. Nahirapan ng makaremember. Concentration may be poor. Eventually, you get the beginning of dementia. Parang ganun yung symptoms. However, this can often be delayed, at least according to Chinese medicine, if the right action is taken. So, yun. It is not inevitable for everyone. Okay? So, kidney deficiency means difficulty reproducing because it cannot warm the gene essence. We might call this the individual's genetic code and the urge to reproduce. Ang causes nito, lower libido in both sexes, impotence in men, okay, premature ejaculation sa mga lalaki, low sperm counts sa mga lalaki pa rin, or sperm is substandard. Kumbaga sa mahinang klase. Infertility in women, okay? So, pag tiningnan natin yung pulse, deep and weak. Kapag tiningnan yung dila, pale and very moist. It may lack of coating if kidney yang deficiency has led to stomach yang deficiency. The moisture of the tongue occurs because the body cannot get rid of fluids, kaya may edema, and it is a sign of in excess and cold. Okay? So, anong gagawin kapag may kidney yang deficiency? So, kailangan alamin natin kung ano yung dahilan nun. Kapag chronic illness, may exhaustion sa katawan, so you may need treatment to improve your health. Part of this could be improving your general health and part on your kidney yang deficiency. So, ano yung dapat kakainin? You must stop eating foods that cool you, yung pampalamig, nakakalamig sa'yo. Some foods, even when eaten warm, have a cooling action. So, kailangan alamin mo kung ano ba yung mga cold foods na yon. Okay? And then, magbasa ka rin tungkol sa mga warming foods. Don't forget to chew well what you eat before swallowing it. Learn better eating habits. Okay? Kasi minsan, lulon lang ng lulon, parang ahas, hindi nanginunguya. Okay? So, physical overwork. Tingnan mo kung ano yung madaling makapagod sa'yo at yung medyo madali para sa'yo. So, question, how long it takes you to recover? If physical after work, It might even be weightlifting, running, straining, hot yoga. Okay, bahala ka na kung anong gusto mo. Pero kailangan piliin mo. Then you need several days to recover, especially if with your tiredness, you get backache or some of other symptoms. Okay? You are overdoing it kapag nagkaroon ng ibang reaction. Listen to your body, not what someone tells you should do, yun gagawin mo. Kailangan kumbaga papakinggan mo yung katawan mo, yung tatantyahin mo, ano ba yung mga dapat gagawin or hindi mo dapat gagawin. Kailangan ka bang magtrabaho ng marami o kailangan ka mag-rest. So, physical overwork includes getting badly chilled. So, make sure you were enough and keep warm. Okay? Too much sex sa mga lalaki. Siyempre, your sexual partners may not welcome this, but you should reduce the frequency of your orgasms. They are exhausting your limited supplies of kidney yang and yin essence. Okay? Kailangan may reserba, wag banat ng banat. that may lead to loss of libido and even sexual impotence. Okay? Yung overuse ng yin essence. Sa mga babae naman, this could occur from having more babies without recovering your reserves. Then, yung anak ng anak, ganun, walang every year may anak, bago. It might occur from too many frequent, heavy, exhausting menses then. So, deep sexual abuse or humiliation might do it. Chinese medicine's experience is that this can also occur if you start having sex too early in life. Remember, while your friend may sail through similar experiences, it's what happens with your body that matters. So, hayaan mo lang yung mga tao kung anong sabihin nila kasi minsan, puro lamang yung kung ano maganda sa kanila, experience nila, sasabihin sa'yo, pero sa'yo naman, hindi naman pwede yung mga ganun, okay? So, these causes may lead to loss of libido and infertility. So, kailangan hindi masyadong pregnancies. Yung pregnancy, siguro mga 3 years bago ka mag-anak uli. Mga ganun. Get treatment for heavy periods. So, yun. Less competing, less stress. Walang masyadong stress dapat. Less drain on your kidney energy. Okay? Lifestyle and work can't always be fixed fast. And it takes time to recover. Hindi naman pwede yung parang pag gumaling ka na, banat na kaagad, no? Diba? Pahinga muna. Tansyahin mo yung katawan mo. But if stress is draining you, you don't really have an option. Okay? So, treatment principle, supplement and warm kidney yang. Ang treatment na gagamitin na acupuncture points, bladder 23, supplements the kidney. Remember po ang points. Ren 4, supplements kidney yin and essence. Ren 6, posters original chi, fortifies yang. Bladder 52, supplements kidney and essence. Stomach 36, yan yung pampalakas. Fosters original chi sa overall ng body natin. BU4 o the Ming Men, supplements kidney yang. Kidney 3, supplements kidney yin and essence. Kidney 7, supplements kidney yang. Yung extra point na Jingong supplements kidney yang. Hanapin nyo na lang po yung point na yan. Extra point Jingong. Needle with supplementation and moxa. So, imomoksa natin. Kapag may severe water swelling, use spleen 9 and Ren 6. To supplement spleen and large intestine, use bladder 20, spleen 6, bladder 25, and stomach 25. Para sa heart and kidney deficiency, use heart 7, bladder 15, and pericardium 6. Okay, thank you very much. I hope you learn. Thank you po.
Thank you. Thank you po. Thank you very much, Mom Needs. Okay, after differential diagnosis, we will now continue with acupuncture patterns and practice. We would like again to request the kindness of Mom Mildred.
Yes, Doc.
Okay, acute strangulation.
Acupuncture pattern practice, acute ano dyan, Doc? Basa? Strangulation. Yan. Yung strangulation, a condition caused by blockage or irritation at the base of the bladder, resulting in severe pain, strong desire to urinate. Siya pala yun. So parang yung, dahil may parang bara, Gustong-gusto mong umihi. So, nakakaramdam ka ng sakit. Yun pala yun. Acute strangury. Miss Zhao, 41 years old, ang main complaint po niya, frequent, urgent, and painful urination with blood for a day. Medical history, the patient suffered from aversion to cold and fever with frequent, urgent, and painful urination after having bath and washing clothes at 2 o'clock in the afternoon the day prior. She had the urge to urinate with interruption every 10 minutes and there were stick of blood in the urine. At maya siya umiihi. Presenting symptoms, aversion to cold, ayaw niya ng lamig, pero wala siyang no sweating, vexation, bitter taste in the mouth, may mapait-pait na panlasa, belching, poor appetite, walang siyang gana, vomiting of a scant amount of next slide po, Doc. Yan. Bitter liquid in the morning. So, pagising niya sa umaga, mapait yung panlasa niya. Mabigat ang kanyang lower abdomen. Tapos mayat-maya siyang umiihi every half hour. Nakakapagod na kaya yun. Urgent and bloody urination. So may dugo na. Painful and cutting-like feeling upon urination. A pale tongue with a white greasy coating and wiry and rapid pulse. So yung physical examination, ang temperature niya ay 38.2 degree. Ang pulse niya is 96. Respiration is 24. Ang blood pressure niya ay 118/78. So normal naman. Urine routine test, WBC is 9,360. Neutrophil 82, protein positive, red blood cell ay napakarami. So may infection siya, no? Pattern differentiation. Strangury is the result of kidney deficiency and heat in the urinary bladder. So the kidney and bladder are interiorly and exteriorly related. Siyempre kasi yung kidney, di ba, yung bladder ang kanyang young partner. Both of which are charged of water management. It is recorded in the classical medical text, kidney deficiency result in frequent urination and heat in the urinary bladder. Produces difficult urination. So nahirapan siyang umihi dahil may heat ang kanyang urinary bladder. Urination that is frequent and difficult is seen in the dribbling and inhibited. This patient had urgent, frequent, painful, and bloody urine, which implies it is a case of extreme heat retention causing blood strangury. Yun. So extreme heat po yung nandun sa kanyang urinary bladder. This patient had an excess retention of dampness in the body, which made her prone to contact exterior pathogenic dampness, which transform into heat and move into the blood layer, causing blood strangury. So, yun po yung pinag-anuan. TSM diagnosis, strangury due to damp heat retention and blood stasis. So, Western medical diagnosis, acute urinary tract infection, UTI. Acute urinary tract infection. Treatment. Ang principle po ay harmonize San Xiaoyang and soothe the Sanjiao. Clear heat and remove dampness. Promote urination and stop bleeding. So, yun po yung principle. So, case study 2. Acute strangury. Miss Liu, 50 years old, main complaint, frequent, urgent, and painful urination for a week with aggravation for 2 days. Medical history, the patient felt pulling pain, distension in fullness and the lower abdomen. So yung mga nararamdaman niya, masasakit talaga. Tapos, ihi siya ng ihi up to 20 times a day. Oh God, nakakapagod na yun. The symptoms were relieved a little after she took erythrozine antibiotic. In recent 2 days, the symptoms were aggravated and she felt burning pain in external opening of urinary tract. Presence and symptoms, meron po siyang lumbago, painful, burning, and urgent urination at saka may fever na. So, yung urine routine test niya, RBC niya, positive. White blood cell niya, positive din. Paano po basahin to? Eucyte, positive din.
+2, pyocyte. +2.
Pyocyte. Yun. Diagnosis, TCM diagnosis, Changuri due to heat retention. So, may heat. Western medicine diagnosis, acute urinary tract infection. UTI pa rin po ano. So, treatment principles, kailangan i-unblock ang chi at saka soothe the sun jiao. Clear heat and promotes urination. So, pag natanggal mo yung heat, mapapayos yun at makakaihi siya. Acupuncture points combination, RN5, SMN, manipulation. So, insert to tune long needle quickly into RN5 with a depth of 1.5 tune. The needling sensations should radiate to the external genitalia. So, pag tinusukan mo po yun, makakaramdam siya hanggang sa external genitalia. If there's no needling sensation, lift the needle to the subcutaneous area. So, pag wala pa rin, i-release mo ng konti. So, mas bababawan mo siya. Kung ang pagkakabaon mo ay 1.5, siguro, i-release mo ng 1, maging 1 lang. Then, insert the needle again by changing the needling direction. Ihahanap mo siya ng direction para maramdaman niya yung chi. Retain the needle for 20 minutes and treat once a day. So, nagtatanggal ka ng heat. Follow-up consultation. After one treatment, the symptom of pulling pain, urgent and frequent urination were relieved, and she urinated 10 times. Nabawasan na yung madalas niyang pag-ihi. So, ang ganda ng points. That day, all the symptoms were resolved after 5 treatments. So, 5 beses lang, okay na. The patient continued 5 more treatments to consolidate the treatment. So, very effective yung points na yon. Acupuncture can be effective in the treatment of acute injury to relieve pain and treat the syndrome, especially the acute phase. Pag acute yung bago pa lang RN5 is the key point of lower abdomen and the front mo of the sanjiao, which is responsible to regulate the waterways. Kaya siya effective kasi nagre-regulate siya ng waterways. Therefore, needling RN5 can relieve stranguri and soothe the chi movement of the sanjiao. Remember to advise your patient to empty the bladder before the acupuncture treatment. O, kailangan mo nang paihiin po yung pasyente. Kasi kung hindi, katutusok mo lang yan, tatayo uli yan, iihi. Kasi lalakas yung bladder niya eh. Okay, thank you po.
Thank you very much, Ma'am Mildred. Any questions? You seem to be very quiet today. Okay, so from acupuncture patterns, diretso tayo ngayon sa signs and symptoms. Let's call straight from Camarines Norte, Sir Alvin Palabay. Good evening, Sir Alvin. Sir Alvin.
Wala pa po siya sa ating
Andyan na. Oo, hindi lang niya ino-on. Okay, baka medyo may ginagawa. So our topic is swollen nose, pag namaga yung ilong. So the first consideration would be damp heat in the stomach and spleen. No, kasi swelling no. So if there is swelling of the tip, tapos red ang nose, sticky yellow nasal discharge, itchy nose spots on the nose. Okay, ito na yung usual no? Feeling of heaviness, sanay na tayo dyan. And there is also, heaviness of the head, feeling of fullness and pain of the epigastrium and lower abdomen, poor appetite, thirst without desire to drink. So this is very phlegm. Very damp pala. Nausea, loose stools with offensive odor. O diba may amoy yung stools, damp heat. Feeling of heat, dull yellow complexion, sticky taste, red tongue, sticky yellow coating, slippery rapid pulse. And another differential pero is lung heat. So yung ilong mo, hindi lang siya swollen, red din. Especially sa upper part. Flaring of the nostrils, cough, slight breathlessness, feeling of heat, chest ache, terse red face, When you look at the tongue, it's red with yellow coating, pulse, overflowing, and rapid. The third consideration would be liver fire. Alam naman natin na liver is the bridge of the nose. Swollen and red bridge of the nose. May headache din, red face, dizziness, tinnitus, irritability. So this is very classic. Propensity to outbursts of anger, thirst, bitter taste, constipation, dark urine. When you look at the tongue, it's red with redder sides and dry yellow coating. Pulse is wiry and rapid. Heart fire. Swollen and red bridge of the nose, especially in the area between the eyes. Red face, bitter taste, of course, may palpitations, thirst, mouth and tongue ulcers, mental restlessness, feeling agitated, insomnia, dream disturbed sleep, no? Feeling of heat, red tongue with redder tip and yellow coating, pulse overflowing and rapid. The fifth consideration would be heart-yin deficiency with empty heat. So swollen pa rin yung bridge ng nose, upper part, palpitations, insomnia, dream disturbed sleep, poor memory, anxiety, o madaling magulat, propensity to be startled. Mental, kasi hindi contained ang shen. Dry mouth and throat, thirst with desire to sip fluids, feeling of heat in the evening, malar flush, night sweating, 5-pound heat, red tongue, redder on the tip, no coating, floating empty, and rapid pulse. Okay, kidney deficiency with empty heat. Swollen nose, dizziness, tinnitus, vertigo, poor memory, hardness of hearing, night sweating, dry mouth at night, 5-pound heat. I think you already know what this is. Feeling of it in the evening, malar flush, menopausal hot flushes, thirst with desire to sip fluids, lower back ache, aching the bones, nocturnal emissions with dreams, constipation, dark scanty urine, infertility, premature ejaculation, tiredness, depression, anxiety, insomnia, excessive menstrual bleeding, red tongue without coating, floating empty, and rapid pulse. Damp phlegm in the lungs. So there is swelling of the nose at the tip and ala nasi, no? Outside of the nostrils. Greasy yung skin. Take note, may dampness. No? Chronic cough coming in bouts with profuse white sticky sputum, easy to expectorate. White pasty complexion, feeling of oppression in the chest, shortness of breath, dislike of lying down, kasi lumalala. Wheezing, nausea, swollen tongue with sticky white coating, slippery pulse. Toxic heat in the lungs. Okay? So aside from swelling of the nose, you will see spots or red papules on the nose. Whole nose feels hard to touch. So galawin nyo na yung ilong nyo kung yung mga nakaka-relate dyan. Pain in the nose, purulent spots on the head, appearing 3 to 5 days after the swelling of the nose. Flaring of the nostrils, fever, headache, cough, slight breathlessness, feeling of heat, chest ache, thirst, red face, red tongue with red points, thick sticky yellow coating, overflowing slippery rapid pulse. Toxic heat at nutritive chi or blood level, swollen nose, painful nose, top of the nose feels hard to touch. Tapos yung tip of the nose may oozing pus, red and swollen nose, dark macules, red cheeks, lips and eyes, fever at night, mental confusion, thirst at night, tremor of the limbs, deep red tongue without coating, floating empty rapid pulse. Okay, heat childhood nutritional impairment, yung mga bata. Swelling of the nose, spots on the nose kasi nga may heat, nose pain, itching of the nose, crusts on the nose, epistaxis is nose bleeding, poor appetite, headache, loose stools, thin body, red tongue with yellow coating, rapid pulse. And lastly, worms in children. Oh, swollen, itchy nose in children. Kaya kung nangangati yung ilong, you might consider purgation, diba? Kasi may mga worms. White vesicles on the face, sallow complexion, emaciation, small white spots inside the lips, purple spots inside the eyelids, loss of appetite, or desire to eat strange objects like wax, leaves, raw rice, abdominal pain, itchy anus. Maraming salamat po. Any questions? Okay. Sir Aldrin cannot make it. May ano po sila meeting. So we will request the kindness of Ma'am Teresita Sumile to take over for anxiety. Good evening, Ma'am Teresita.
Good evening po, Dr. Hector and classmates. Our topic tonight is identification of patterns and treatment under anxiety. Heart and gallbladder deficiency, clinical manifestations, palpitations, anxiety, timidity, easily frightened, lack of self-assertion, easily discouraged, cannot sit or lie down, insomnia, waking up early in the morning. The tongue is pale and at ang pulso po niya ay weak. Then mental emotional profile of a person with heart and gallbladder deficiency is this person is timid, shy, and lacking in drive. He or she is easily discouraged and finds it difficult to make decisions because gallbladder is the organ in charge of our decision making. So if gallbladder is deficient, so the person will have difficulty in making decisions. Okay, the anxiety is mild. Then treatment principle, we have to tonify the heart and gallbladder to calm the mind. Okay. Heart and gallbladder deficiency points, we have heart 7, heart 5, bladder 15, ren 14, gallbladder 40, and stomach 36, all with reinforcing method. And moxa is applicable if the tongue is pale. So we should have to see first the tongue before applying moxa. If the tongue is red, then please don't apply moxa. Okay. Then heart 7, heart 5, bladder 15, and ren 14 to tonify the heart and calm the mind. Gallbladder 40 tonifies the gallbladder, and then use this point in particular to stimulate the psychic aspect of gallbladder, that is courage and assertiveness. Then stomach 36 is used to tonify the heart. Heart blood deficiency. Clinical manifestations are palpitations, anxiety, dizziness, pale face, insomnia, poor memory, and tiredness. Tongue is pale and thin at ang pulso naman ay choppy or fine. Okay? Mental emotional profile of a person having heart blood deficiency. This person is most likely to be a woman, pale, depressed, and anxious. The anxiety is mild and she hides it well. Okay? Treatment principle is to nourish heart blood and calm the mind, sorry. Then heart blood deficiency points are heart 7, ren 14, stomach 36, spleen 6, and all with reinforcing method. Moxa may be used. Okay? Heart 7 and ren 14 nourish heart blood and calm the mind. Then stomach 36 and spleen 6 are used to nourish blood in general. Now let's go to kidney and heart yin deficiency with empty heat. Clinical manifestations. Palpitations, anxiety that is worse in the evening, mental restlessness, insomnia, night sweating, feeling of heat in the evening, 5-palm heat, dizziness, and tinnitus. The tongue is red without coating and the pulse is floating, empty, and rapid. Then mental emotional profile of a person having kidney and heart yin deficiency with empty heat. This person is more likely to be middle-aged. The anxiety is marked and is experienced more in the evenings. In women, this type of anxiety is marked, This type of anxiety is markedly aggravated with the onset of the menopause. There is a characteristic restlessness and fidgetiness. Kidney and heart gene deficiency with empty hit points are heart 7, REN 14, kidney 3, REN 4, spleen 6, heart 6, and kidney 7. All are reinforcing method. Treatment principle is to nourish heart and kidney yin, clear empty heat, and calm the mind. Explanation of acupuncture points. Heart 7 and REN 14 nourish heart yin. Kidney 3, REN 4, and and spleen 6 is to nourish kidney yin. Heart 6 clears heart empty heat, and together with kidney 7, it treats night sweating. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Okay, marami ba kayo natutunan? Ulitin nyo na lang.
Opo.
And thank you po for your attendance. And we'll see you later for balance method with Dr. Gavino. He will take up systems 4, 5, and 6. Maraming salamat po sa lahat, especially sa mga presenters. Good evening.
Thank you din po.
See you later. Bye-bye.
Good evening.